My name is Dionysia Iliopoulos, and my PI for this literature review is Dr. Kimberly Jones-Rudolph. This literature review is primary failure of eruption, mechanical failure of eruption, ankylosis, and their orthodontic implications. So we'll be reviewing that in this presentation. One complication faced in orthodontics is the failure of a tooth to erupt. Understanding the issues that cause a failure of eruption or ankylosis helps the provider determine the best clinical treatment. Tooth eruption begins intraosseously and involves metabolic changes in the alveolar bone, largely regulated by the dental follicle. It is defined as the movement of the developing tooth from its non-functional position in the alveolar bone to its final functional position in the oral cavity at the occlusal plane. As the crown finishes development and root formation begins, bone resorption occurs, clearing a pathway for a tooth to erupt. The tooth navigation through overlying bone and oral epithelium is sequenced bilaterally, along with the growth of the jaws. Failure of this eruption process can be the result of local, systemic, genetic, and environmental factors, and can lead to various eruption disorders such as primary failure of eruption, mechanical failure of eruption, and ankylosis. Eruption failure can affect one or multiple teeth, the primary or permanent dentition, and can be partial or complete. Despite their rare occurrences, they have significant clinical implications, making early diagnosis and treatment essential to proper management of these conditions. The aim of this paper is to provide a review of the available literature on the etiology, diagnostic criteria, clinical and radiographic characteristics of primary failure of eruption, mechanical failure of eruption, and ankylosis, and their implications in orthodontic treatment. Methods: using an electronic search of PubMed and Web of Science, appropriate systematic reviews, traditional reviews, and case reports in the English language was selected from the years 1999 to currently 2022. Articles were selected using a combination of terms such as tooth, eruption, failure, orthodontics, PFE, short for primary failure of eruption, or MFE, short for mechanical failure of eruption, ankylosis, and mechanical. This was supplemented by a manual search of reference lists taken from identified publications and relevant articles from referred journals. Eligibility of selected articles was determined by screening the titles, keywords, and abstracts of potential studies identified from the literature researches. Results: a total of 21 publications were identified and conformed to the inclusion criteria for this literature review. Reported diagnostic criteria, case report findings, and subsequent orthodontic treatment recommended for primary failure of eruption, mechanical failure of eruption, and ankylosis described in the identified publications were extracted and organized in this paper to facilitate proper clinician diagnosis and treatment modalities. They are organized in this table below. Proposed etiology of each of these three conditions is described. Primary failure of eruption, its etiology is unclear. However, it is linked to an autosomal dominant inheritance of a mutation on the parathyroid hormone receptor type 1 gene. Mechanical failure of eruption etiology is the presence of an obstruction within the tooth's pathway, while the eruption mechanism itself is normal. Ankylosis, its etiology is the anatomical fusion of tooth cementum with alveolar bone. Clinical characteristics of each of these conditions is also described in order to help a clinician diagnose their patient. Clinical characteristics of primary failure of eruption is posterior teeth are more commonly involved than anterior teeth, while molars are more commonly affected than premolars. All teeth distal to the most mesial affected teeth exhibit this disorder as well, leading to a posterior open bite. This occurs both unilaterally and bilaterally with no significant difference in incidence between left or right sides. It occurs in both the maxillary arch and the mandibular arch, oftentimes at the same time. Can affect any or all posterior quadrants. It is associated with a family history. Skeletal class 3 incidence is higher than population norms, and hypodontia incidence is higher than population norms in patients that have primary failure of eruption. Mechanical failure of eruption, clinically, only the involved tooth is affected, not teeth distal to it. And this condition's onset, the onset of this condition immediately follows the obstruction, and the tooth will cease movement. For ankylosis, its clinical characteristics include a loss of arch length, tipping of adjacent teeth towards the ankylosed tooth, shifts in the dental midline, supereruption of opposing teeth, and an open bite. This ankylosis can occur during eruption, either before or after the tooth emerges in the oral cavity below its plane of occlusion. Both primary teeth and permanent teeth are affected. The most frequently affected permanent tooth is the mandibular and maxillary molars, followed by the maxillary canines. Most frequently affected primary tooth is the mandibular second molar. Radiographic characteristics is also illustrated in this chart. Primary failure of rupture, you'll see enlarged bony crypts around the tooth germ's crown formed due to resorption of the alveolar process, suggesting a proper resorption of the bone and a deficiency of the eruptive forces to move the tooth through the path of eruption. Mechanical failure of eruption, obstruction of the eruptive pathway will be visualized, and this can be due to either supinary tooth, an adjacent impacted tooth, cysts, a loss of space within the arch. Ankylosis, the radiograph can exhibit an obliteration of the periodontal ligament in the area of fusion between the bone and cementum. Its orthodontic implications for primary failure of eruption. Any attempt to extrude the affected tooth or teeth orthodontically is likely to result in its ankylosis before reaching the occlusion. So it might have an initial positive response towards orthodontic treatment, but it will soon be followed by ankylosis. This will affect the adjacent normal teeth as they will intrude while the affected teeth are attempting to be extruded. For mechanical failure eruption, it's usually successful with orthodontics and possibly surgery if needed. It usually involves removal of the obstruction. For ankylosis, the affected teeth do not respond to orthodontic intervention. In conclusion, a common clinical dilemma is distinguishing primary failure eruption, mechanical failure eruption, and ankylosis, as they can have a similar clinical appearance. The clinician must first rule out more common causes of an open bite, such as mechanical failure eruption or tongue thrust, as these can typically be treated successfully with orthodontics or surgery. It is then crucial to recognize the difference between ankylosis and primary failure eruption, as they dictate distinct treatment modalities and are different from each other. An inaccurate diagnosis can lead to an inappropriate and extended treatment time, patient frustration, financial burdens, and poor occlusion. So this literature review just outlines the different characteristics of each of these conditions, how a clinician can make a diagnosis clinically and radiographically, and how they should go about in treatment modalities for each of these different conditions. Thank you.